So now here, this is the flexor retinaculum. So what side of the wrist is that on? Anterior or posterior? Palmar or both?
Anterior.
So it's on the palmar surface, right? Because these are the flexors. So then there would be an extensor retinaculum, but the one on the flexor side is what we talk about more commonly because it's going to be the roof of the carpal tunnel. So then, like I say, there's all these different ligaments in here. They're basically named by what two bones they attach. So in here we have the piezohamate ligament. And what that does is because you're going to have the flexor carpi ulnaris is going to go into that piezoform, and then that ligament is going to transfer force into there, so it's going to help with movement of the wrist. And then also, this piezohamate ligament, that's the roof of the tunnel of Guillain. So we'll talk about that when we talk about the tunnels. But so you have the flexor retinaculum covers the carpal tunnel, and then the piezohamate ligament covers the tunnel of Guillain. And that's in the notes on the next page too. All right, so then of course we're going to have collateral ligaments. So what would you call the one on this side? Yeah, radial or lateral collateral, and then ulnar or medial collateral. And then the volar plate, you have the collaterals on either side, let's say on the fingers, and then the volar plate is on the palmar surface of the fingers. It's like a ligament that goes in between the spans of the joints. All right, so then now we talk about the tunnels where the nerves go through. Right, so when we're talking about the tunnels, usually we're going to talk about the boundaries of it, like which structures form the actual outline of it, and then the contents of what goes through it. So again, here's the collateral ligaments. You have a radial and ulnar collaterals. Then the volar plate. I mean, I've specifically seen it mentioned where it talks about this part here, but I would assume that that's also a volar plate there on the DIP. So here, they were traveling through the carpal tunnel. Right. So the boundaries are mostly going to be bone. So, you know, coming across here, we're basically naming the different bones. So you have the navicular or the scaphoid, same name, same thing. And then the trapezium here. And then the pisiform and the hook of the hamate. So basically there's two on this side and two on this side, and then there's the ligament that goes across. Right? So that's the flexor retinaculum. So basically you have, you know, one here, one there, one here, one there, and then the ligament that goes across. And then we talk about the contents that go through it. So of course the main thing is the median nerve, right? And then everybody know what these abbreviations are? Should be able to figure them out, right? So these are all flexor muscles, so the F is going to be flexor, then carpi, flexor carpi radialis, flexor pollicis longus, flexor digitorum superficialis, flexor digitorum profundus. Does anybody know what other muscle is left out of that? That's a flexor muscle that doesn't go through the carpal tunnel?
Palmar longus?
Yeah, palmaris. That's like this one that you can see kind of sticks out more. All right. So now you have this tunnel of Guillain. And see, it doesn't go under that flexor retinaculum. It kind of makes a sharp turn there and goes under that piezohamate ligament between the hamate, hook of the hamate and the pisiform. And then you can see that continues to where the distribution of the ulnar nerve in the last two fingers here. All right, so again, the boundaries, you have the pisiform, the hook and the hamate, and then the ligament that goes across the two. And then what nerve goes through there? Ulnar nerve, and then we also have an ulnar artery in this situation. All right, so those are all the inert tissues. We talked about the bones, the joints, ligaments, and then the things that make up the tunnels that the nerves go through. And now we get into the contractile tissue. All right, so we divided into that into two categories. Remember what those were? Well, yeah, intrinsic and extrinsic. But yeah, they're mostly going to be the flexor extensors too, but this divides it between where the muscle bellies are in another place and the tendons come in and all you have is tendons in the hand, versus intrinsic muscles where you have the attachments, the muscle belly and everything within the hand. All right. So as far as the intrinsic ones, you have the pollicus. There's several different muscles that go to the pollicus means thumb. So there's a few muscles here. Basically the thenar pad has some muscles in there. Same thing on the hypothenar. There's going to be some other muscles over here. And then there's lumbricals and interosseous muscle. We don't necessarily need to get into all the details of those, but just understand that there's intrinsic muscles that are within the hand itself. And those are either between the metacarpals or mostly on the palmar surface. There's not really much on the back side of the hand. And then the extrinsic muscles, basically those are pretty much all the ones that we talked about when we talked about the elbow, because most of those attach up here. And by the time they get through here, they're just tendons, right? So there'll be all these ones here, and then the tendons that are going through the carpal tunnel. All right, so now we come back again to the nerve tissue. So then what nerve is this distribution? And what's this one? And then, so we get radial here. So again, like I say, most of the time they'll talk about beyond the PIP joint, that being of this second and third finger being the median nerve on the back side, whereas radial just goes into here. And there you see the median nerve as it goes through the carpal tunnel, and there's the distribution of the median nerve. Then we talk about the vascular tissues, and then these are the ones we did before. We did the checking the vascular supply to the hand when we were talking about carpal tunnel. So you have the radial artery and the ulnar artery. Now, which one of those goes through a tunnel and which one doesn't? Ulnar artery goes through the tunnel, the radial nerve doesn't. I mean, radial artery.